Mental health challenges are on the rise among youth. Data from the Centers for Disease Control and Prevention shows up to 1 in 6 children ages 6 through 17 experience a mental health disorder, but only 20% receive care from a mental health provider. The Michigan Department of Education is trying to help schools and their staff address the mental health among students, and they've developed a new guidebook.
I call it the perfect playbook for any school district as they're looking to address mental health needs in their district.
When the guidebook was first brought to the attention of Mayville Community Schools Superintendent Seaman, he knew he needed this for his district.
And it's a step-by-step guide with a bunch of resources that allows you to help your teaching staff and your educators deal with mental health, but it also has a portion that deals with the families and communities.
Over the course of his time in education, Seaman says it's changed. However, one thing has remained the same. Students need to be in a great mindset in order to learn.
It's going to be hard to teach them the math, the science, the social studies, and the English.
The guide was developed with input from more than 50 people across the state who have backgrounds in social work, psychology, teaching, and also parents.
It's looking at a multi-tiered system of support and really looking again holistically at what the needs are of your entire student population.
There are classroom lessons available for teachers and assessments for staff to learn how to recognize the mental health needs of a child.
We call it mental health literacy, so making students and staff aware of, again, why do we act the way we act sometimes, or why do we react?
Recently, some parents have expressed concern about what's being taught to students. I asked Scott Hutchins, the supervisor of the school behavioral health unit at the Michigan Department of Education, does this guidebook provide therapy for students without informing the parents?
No, not at all. So again, that there are multiple layers to a comprehensive school mental health system, and one of them, to your point, does include if students again have access to a licensed mental health provider that works in the school, but the same mental health codes apply to the state of Michigan in schools, community mental health setting, child mental health centers, hospitals, etc. Again, you can't work with a child under the age of 14 without parental consent.
Michigan is a local control state. That means it's up to districts to decide what if they use this guidebook, and it's not a requirement but available to school leadership.